Assalamu alaikum. I am Dr. Momina Zahra, working in Dental Education Department in Rifa Dental College, Islamabad. Today I'll be presenting our research titled Assessment of Manual Dexterity in Dental Students, Evaluating Skills for Clinical Proficiency. Let's explore how we measure and correlate dexterity with real clinical performance. Manual dexterity is critical for dental professionals, be it a simple cavity prep or complicated surgical procedures. Our research investigates whether psychomotor tests can reliably predict clinical readiness or not. For that, we selected 75 second year BDA students and assessed their skills through validated tests and structured simulation tasks. Our research was a mixed method study involving quantitative data collection along with qualitative Delphi consensus building. If we ask the question that why does dexterity matter? That's because it provides an early insight into a student's hand skills, which traditional systems often miss. Objective metrics help identify those needing intervention, refine training programs, and reduce subjectivity in clinical evaluation, ultimately promoting a safe patient care environment and confident graduates. In our research, we use Purdue Pegboard test, a widely validated psychomotor assessment tool which helps evaluate manual skills and eventually leads to enhanced clinical proficiency. Students completed multiple subsets as seen in the photographs using dominant hand, non dominant hand, both hands, and then an assembly task. Results revealed progressive improvement with practice. Furthermore, we measured grip strength using a digital dynamometer, another assessment tool. Hand strength impacts how well students can control instruments, particularly under pressure. We observed that strong grip correlated with better performance in simulation tasks. Moving on, we then evaluated students on a cavity preparation task using phantom heads. Faculty assessed them using detailed rubrics examining margins, outline form, depth, posture, and ergonomics. Scores were compared with their dexterity and grip results to establish correlation. To ensure standardization, we used a Delphi method with experienced dental educators. Multiple rounds were conducted to refine the assessment rubric with over 75% agreement achieved. We combined this expert insight with quantitative analysis across 75 students. This mixed method approach balanced objectivity with clinical nuance. Moving on to the results of our data, it showed a clear correlation, meaning that the students scoring higher on the pegboard and grip tests performed better in the simulation. This validates dexterity testing as a predictive tool. These displayed numbers are a few of the stats extracted from our dataset. Keeping in view the importance of early manual dexterity development, we've also added a maze activity in the CST module of first year BDS here at Riva, where students navigate a maze using indirect vision under timed condition, as shown in the picture. This strengthens fine motor coordination and clinical focus. We highly recommend integrating these tests early on in the curriculum to guide teaching and personalize feedback. It's a step forward, evidence based, fair evaluation in dentistry. In summary, psychomotor tests like the Purdue and grip strength tests offer practical data backed ways to assess clinical readiness. Our study provides a framework for objective skill evaluation and opens doors for curriculum enhancement and research based training. These are some of the references of studies that we picked our information of the presentation from. Thank you so much for your time. Allah Hafiz.